I'm Madison Mills. This is Bloomberg Quick Take. COVID infections caused by the Omicron variant are surging in the U.S., with the country averaging more than 118,000 new cases every day. And that is the highest numbers we've seen in the course of the last 3 months. The CDC expects weekly cases to jump by 55% to over 1.3 million total cases by Christmas Day. So how worried do we need to be right now, especially as a lot of us are about to be traveling home? Let's bring in Dr. Peter Hotez for some answers here. He's joining us from Baylor College of Medicine. Dr. Hotez, always great to speak with you. This morning, I woke up to about a dozen texts from people who've had all 3 jabs and they've tested positive. It just feels like everyone is getting this right now. How worried are you? And in your view, is this a repeat of March 2020?
Well, as I often like to say, each new variant has its own unique characteristics, or really its own little shop of horrors, and this one is different from the others, but it has some unique features. So let's kind of go through a few key points. First of all, this is not surprising that we have the Omicron variant here. Anything pretty much that's been a major factor in the United Kingdom, usually there's been about a 4 to 6 week delay for it to come to the United States. That was true of Alpha. That was true of the Delta variant. Unfortunately, it got here much faster. I had hoped it would be here after the holidays, but it looks like it's going to disrupt the holidays in a big way. And those texts that you got actually make a lot of sense. Here's why. That third immunization you get with the mRNA vaccine, it gives you a huge rise in virus neutralizing antibodies. And those antibodies spill over to help protect you against the Omicron variant. But it's still not as effective as it was against previous variants. So whereas the 3 doses of the mRNA might protect you more than 90% against the Delta or Alpha variant, it's gone down to 70 to 75% versus Omicron against symptomatic illness. And that's why you're getting the texts. Moreover, the virus neutralizing antibodies are not staying up as long. So 70 to 75% may be best case. It may start going down if it's been 2 or 3 months since you got that third immunization. And this is going to create a particular problem among healthcare workers. So I think we're going to have a lot of healthcare providers, especially in hospitals, calling in sick. Not that they're getting very sick and going to the hospital, but sick enough so they can't be in the workforce.
So are these breakthrough cases making people a little bit less sick if they're vaccinated and if they're triple boosted?
Well, we're not seeing a lot of serious illness among those who are triply vaccinated, but they're still getting symptomatic illness. Therefore, they have to be isolated. We don't know what that means in terms of long COVID, so it's still a serious situation. And as I mentioned, all among the unvaccinated who'll be piling into hospitals now, there's going to be a lot of healthcare workers with breakthrough symptomatic illness that are going to have to call out sick. So that's going to create a very unstable situation. And that's, I think, as I say, with each variant, you got its own unique problems. This is going to be the problem we face with Omicron.
What's the quarantine period for those vaccinated folks who test positive?
Well, usually we're looking at potentially 10 days, but the CDC guidelines are always sometimes in flux, so it's good to talk to your healthcare provider and look at the CDC guidelines if you have questions. So it's cdc.gov, and you can get the more specifics.
Let's talk about the holidays, because obviously people are already home, about to go home, right as we're learning a lot about this variant. Would you recommend people not go home? Should they change their travel plans?
Yeah, it's hard to be that granular. I mean, I can tell you my own situation. We were going to have my mother-in-law and sister-in-law fly in from New Jersey to come to Houston, go to a couple of restaurants, museums. We were very happy and excited about have that. She's, in her 80s, has had triple immunization, but we didn't want to risk having that breakthrough symptomatic illness in her. So we kind of had to disinvite her, and that was very sad. Until things quiet down in this current surge. So I think this is happening across the country now. People are kind of looking at the risk-benefit ratio, and it's easier for me because I have an MD and a PhD, right? But I know it's very tough for people now trying to figure it out on their own. So I hope we get more guidance from the CDC on these points.
If people are, let's say, about to get on an airplane, Dr. Hotez, what can they do to keep themselves and their family members as safe as possible? Let's say they're all vaccinated in this case. Do they all need to go get PCR tests?
Well, first of all, there's vaccinated and there's vaccinated. The CDC, I don't know why they do this. They still define full vaccination for mRNA as 2 doses. I don't feel that way. I feel full vaccination is 3 doses. So you want to make certain anyone is eligible for a booster, either for yourself or anyone you're interacting with has gotten that booster. That may be the most impactful thing you can do. Also, of course, put a mask on if you're in public settings, in an indoor setting. Wear a mask at all time, and the more you can test, the more belts and suspenders you have in terms of support. But you have to be very mindful about who you're visiting and who you are, who's doing the visiting. By that I mean, if someone has immunocompromised, they may not respond as well to the vaccine, or if they're extreme age, they might not respond as well to the 3 doses. All of those things have to be kept in mind.
Why, in your view, is the CDC dragging its feet on requiring that 3rd dose as part of the definition of a fully inoculated individual?
I don't know. I've always said since January this is a 3-dose vaccine. I don't see why that's so terrible. I think part of it is, they're very concerned, as we all are in the medical and scientific professions, about those who are refusing to get any vaccines. And I think the thinking is, and I don't pretend to have the inside baseball on this, but I'm guessing the thinking is that by saying it's 2 instead of 3, that seems to be less daunting for those who are refusing to get vaccinated altogether, and that if they go to 3, that's just going to make it seem like it's not an attainable goal for people who are still sitting on the fence of getting vaccinated. So I think it's among the hesitant, and I understand if that's the case, but we've now learned that it's hard to have the same dialogue to 2 different populations. We've got one group of Americans that are all in, right? The 60% who are doing everything they can to protect themselves and their families, getting vaccinated, wearing masks, and then we have a quarter of the nation that's still holding out and defiant and tying their political allegiance to not getting vaccinated. And so what happens is, you have to have really 2 sets of discussions with these groups and talk to them in different ways. And I think what we're seeing coming out of the CDC and the federal government is they're trying to use one message for the whole American population, and it comes out as baby talk, and I think that's part of the frustration.
Right, we'd rather just be told, in many cases, the specific situation at hand rather than kind of having to guess. I do want to point out the waning immunity that is part of the process when you get vaccinated, right? We're seeing that immunity induced by vaccines does decrease over time. Given that, are we over-relying on boosters to save us here, or is that just kind of our only option?
Well, here's the place where I kind of got off guard a bit. When I said it was a 3-dose vaccine, my thinking was that it was going to act like other vaccines, where you get your first immunizations, you wait a while, you get boosted, and then you've got not only the rise in virus neutralizing antibodies, which you do, but then you get durable protection, sometimes lasting years. So I was saying, well, it's not going to be 1 and done and 2 and done, but it could be 3 and done. I think for me, the shocker is that against the Omicron variant, it's not holding up that well. And it may not be as long lasting. And that's still very squishy and tenuous. It's based on some virus neutralizing antibody out of Germany. So I don't know how long that 3rd immunization is going to last at this point. And we may have to revise our thinking about the need for more frequent booster. It may be an overall problem with the mRNA technology. It's still too new, or it may be something very specific for Omicron.
Do we need to encourage a smaller time frame between booster shots?
We may for the Omicron variant, and so that's where we're going to need some real communication coming out of the Centers for Disease Control and others. And the reason I bring this up again is the healthcare workers, right? If they're 2 or 3 months out from their 3rd dose, we don't have the luxury of allowing them to get symptomatic COVID and be out of the workforce.
Right.
So if they need a 2nd booster, a 4th dose, let's find out about that sooner rather than later to keep them in the workforce during this surge.
All right, really quick final question for you. Dr. Fauci this morning said that some types of tests can't detect Omicron. He didn't name names. What do you think he was referring to? Was he referring to rapid tests? Do we need to stop relying on these at-home tests?
No, I think it's the some of the PCR tests. So what you sometimes there different PCR assays test for different parts of the virus. Some the N protein, some the spike protein. So one of the ways that Omicron got picked up was because the PCRs were positive for the N protein, but negative for the spike protein because there were so many mutations in the spike protein. So again, we'll have to look at some guidance on what has the ability, and I couldn't tell you off the top of my head which particular kit has the ability to detect both the original lineages and Omicron as well.
All right, Dr. Peter Hotez, thank you so much for joining us and giving us some context on the Omicron variant. Really appreciate it.